Hi, I'm Aidan. I'm an associate consultant in the UK team. I have ADHD, and that's okay. You may have heard of ADHD. It stands for Attention Deficit Hyperactivity Disorder, which is a really bad name because a lot of the time we don't have a deficit of attention, we have too much. There's so much shiny, interesting things going on at one time that we find it difficult to regulate that attention. This is due to a lack of release of dopamine and norepinephrine in the brain. This means it's actually pretty difficult to try and focus on one thing or actually develop the motivation and willpower to do a thing. Oftentimes I find myself looking at my to-do list knowing exactly what I have to do, but my hand is on my phone looking on YouTube, and consciously I know that I need to stop doing that and focus on the thing, but the brain says no. So one thing that I have that helps me is these. These are, still not sure how to pronounce it properly, but Zagatin. It's a methylphenidate hydrochloride. If you're in the US, you probably know it as Ritalin. And it's okay to take medication. We take painkillers when we scratch our arm. We take antibiotics when we have an infection. It's okay to look after your brain as well. Mental health conditions are invisible. You have absolutely no idea what anyone's going through until you talk. Recent stats in the UK show that 1 in 4 people will experience a mental health issue in their lifetime. In this year, and that's in a normal year. We can already see worrying signs about how much of a negative impact lockdown, quarantine, loss of routine and connection with people is having on our brains, which means it's more important than ever to talk about it. It's a really scary thing to do, to be vulnerable, especially with stigma, previous views of years gone by that can still negatively impact us. But if there's one thing that helps, it's talking about it. Talking about your mental health isn't weak, it's one of the bravest things you can do. So go on, how are you really doing today?